All right. So we have a therapy that is Beck's cognitive therapy that we have been talking about, and this is the therapy uh, cognitive restructuring. See, the last two treatments, ECT and drugs, were biological in nature. This is cognitive, as per the name highlights. So this is a therapy given by Beck. Uh, and you know, if you understand this therapy, you will understand Beck's original theory of why this is free will. So if you understand this, you would understand why Beck's negative triad is about free will. So basically, states that this is why you're depressed, right? The negative triad. You have negative views about the world, the self, the future, and the only way to get out of depression is if you stop negative thinking. So the name highlights cognitive restructuring, as in you're going to restructure your thinking process so that you don't think negative things. So the way to do that is there are different techniques. The syllabus does not require me to go into techniques, but I might go into steps of how it is done so you may have a better understanding how is this thing carried out in general. So basically, the first step is to explain the person who's your patient or how this is going to work. You're going to tell them everything beforehand that in this therapy, we're going to change your negative thoughts. For you to do that, you must understand and find out your negative thoughts, identify your negative thoughts, and then slowly replace them with alternative thoughts. So you kind of make them aware of what's going to happen to them. And I guess that's pretty ethical as well because you're telling them what's exactly going to happen. So first of all, you kind of explain the rationale behind the therapy, and then once they understand the rationale, then you begin the therapy. So first of all, like if a person is depressed, they have been so used to thinking negative thoughts that it is natural for them. They don't think that negative thoughts are negative thoughts, right? It's just thoughts. But you, as a therapist, know better. So you kind of help them identify negative thoughts that they are thinking. Uh, and it could be very difficult for people because they can't uh, differentiate between thoughts and negative thoughts. For example, they might say that the person who cut me off in traffic ने मुझसे बदतमीजी की है. A person might think that's a general thought, but it is a negative thought because it is making you feel bad. कि तुमसे बदतमीजी की है, right? There could be other alternative explanations that he might be, late for work or something. So you help the person identify negative thoughts. So first is helping the person identify negative thoughts. Second, once the person identifies the negative thoughts, then you kind of prove, you kind of then prove those negative thoughts wrong. You kind of, before changing a negative thought, you have to first see whether it's true or false, right? You cannot dismiss a thought just because it's negative. You need to know whether it's true or false. So you kind of do this thing where you evaluate whether the negative thought is true or false. And if it's false, you replace it with some other thought that is not negative, that is much more healthier. So one of the technique we use is to a seven column technique. You don't have to know this. You don't have to know the steps, but generally, situation is person cut me off traffic, right? Just like we discussed, emotion that the person was feeling was angry. How much percentage? 100%. NAT is negative automatic thoughts. Negative automatic thoughts are thoughts that you think at that moment when that situation happened to you. So once you got the trigger, what's the thought that you got automatically? Person thinks push over, right? I'm a push over. So then you kind of dispute the negative thoughts. You write reasons uh, that support that negative automatic thought is true. So like reason So like reason number one, reason number two, reason number three, and you also have reasons that this negative thought could also be false as well, as in that person might be late for work. This does not happen to you every day. It is just this instant that this happened to you. Normal people are nice in traffic. So overall, the idea is to like have more evidence for against more evidence for four. So let's suppose like we have three evidence, four evidence here, and two evidence here. So the person will look at this and say that I have more evidence here than this. So it is possible that my thought that I was thinking here is wrong, and then he will think something alternative. Maybe he was it. And then we look at, all right, so if you now think this, what's the result? Your anger like reduces by, let's suppose, like 50%, and you feel calm 100%. So that's the outcome that we're going to do. Change of the person, identify the negative thought, uh, find, analyze it, find evidence against it, and then change it by having an alternative thought so that the person may have a positive outcome. And that's what CRT is basically. So you do this for different triggers till a person stops thinking negatively and can do this without having to, like having without having to use columns. You do this till the person can do it naturally, easily, and then you let them go, and then they're free to, like do it on their own. So that if they won't need to do therapy. So basically, it is free will because you cannot change a person's thought without their own input. Obviously they would have to come up for evidence for and against. Obviously they themselves would have to think of alternate thoughts, and this won't happen unless and until the person is willing. So it's free will. This is given as a homework. If a person doesn't do their homework, it won't work. So it is free will. It's very cost. It takes a long time, 8 to 12 sessions. So it's not cost effective. It is cognitive in nature. So it is reductions in that sense. Individual situational, you're changing the person's individual thought, you're not changing their situation. So it's individual. Nature nurture, you're teaching them something, how to identify and replace your negative thoughts. So it's nurture. uh, it's very appropriate because it has no side effects, and the person can do it once they get the hang of it, can do it anywhere in their office, in their home, can practice this exercise. Has no side effects, and this can be used for multiple situations. Like I'm giving example for depression, right? So you can do this for variety of situations like anxiety as well. So whatever the person's learned here can use it for other situations and circumstances. So it's very flexible. Drugs are not flexible. Drugs are only used for that particular situation. You cannot use that drug for some other symptoms. Drugs are not flexible. This is flexible. uh, so that is CRT. So, is there evidence that this works or not? Well, Dobson did research. Uh, People who are depressed, half of them have CRT done on them, and half of them have drugs applied on them. At the end of the result, people who were taking therapy improved 70% on the Beck depression inventory, which shows that their symptoms improved 70% as compared to a drug. Dobson says the CRT is going to improve people more when you give it to them as compared to drugs. Other research, we have Wiles, is in your syllabus. So Wiles has a huge number of people who are having depression. Whenever I write major depression, make sure that it means unipolar depression. So he divides them into two groups. People are already taking antidepressants, so half of them keep taking the antidepressants, and half of them to also take antidepressants but are given CRT as well. CRT and CBT are interchangeable, but I wrote CBT, but you can refer to as CRT. So CRT plus drugs and drugs only. So it turns out that people who are given the combination of CRT and antidepressants uh, had their symptoms reduced more than only taking drugs. So this means that CRT will help the drugs reduce the symptoms more than as compared to drugs working alone. So like it increases the drugs effectiveness, I would say. Like it makes the drugs more effective. So CRT can also be used in combination with drugs. Last research by Burns, he did it on women who were depressed during pregnancy, as known as antenatal depression. So generalizability might be low, but will this CRT technique help women? overcome their depression during pregnancy. So again, half of the women were given usual care. Usual care is something that you normally do in those circumstances in the hospital, like nurses and etc. And half of them were given CRT. Uh, at the end, what you found out that people who recovered in 15 weeks, 68.7% of the women recovered from the CRT program, but from usual care, 38.5% recovered. So CRT kind of helps people improve more in antenatal depression than the usual care given in the hospitals. So these all researches support CRT. I guess that's it. If you have more questions, you can ask me. There's no problem.